When I think about my job, I have to put it into like multiple categories or buckets. There's my clinical role, right? I direct and run a transcranial magnetic stimulation clinic at Butler Hospital. And there I'm overseeing staff and taking care of patients and organizing how the service works, giving patients these brain stimulation treatments that are part of just insurance-covered care. And I get to work closely with the patients, and I really enjoy that. I also have a role as a researcher in my lab. I run clinical trials, everything from medications like esketamine to all sorts of device-based treatments. I've been a principal investigator on device-based treatments for depression, including deep brain stimulation, vagus nerve stimulation, transcranial magnetic stimulation, and now a whole new generation of take-home devices that are ones people use to treat mood and anxiety disorders. So I do the clinical trials, and I do mechanistic studies involving imaging with fMRI and EEG. And then when I think about the other parts of my job, there's the administrative roles. I'm chair of my institution's IRB, which is the Institutional Review Board. So in that role, I oversee the submissions and the approvals of regulatory matters that relate to the research that my colleagues are doing. And then I guess when I think about my other roles, there's the role I have, which is actually not small, where I'm involved in a bunch of organizations, the stuff that doesn't pay me, right? My leadership roles in organizations like SOBP and Clinical TMS Society and ACMP, and I tend to put a lot of energy into committees and engagement with those sorts of organizations. I think I have the perfect mix of research and clinical work. I love what I do. I love the clinical work. I think it's been really important for me to keep my clinical work in my life so that I'm involved with patients, a part of their journey from suffering to getting better. And in the world of TMS, with TMS treatments, we see patients who have been sick for decades with depression and not getting better with a lot of treatments. And then we follow them through a course of 2 or 3 months of brain stimulation, and they get better, and that's really inspiring. And even the patients that don't get better, I think, are really inspiring because they inspire these questions that I have for my research, like how could I, do I recognize something there that I want to change, I want to fix, that I want to engage my time in answering that question, how to do it differently, how to do it better. What does that person need that I haven't got in my toolbox right now? So I think of my job in all those different ways. As you grow up in the field, as a researcher, you're inevitably going to inherit more and more administrative roles, unless you just have massive amounts of funding, I suppose, to protect yourself. And that's the part that I think is challenging, but I've tried to, at least with my IRB role, I've tried to turn that into something that's a really important asset for our institution and my colleagues. I like to think we're the quickest, friendliest, most researcher-oriented IRB, and that I can help kind of facilitate the research activities of my colleagues in a way that I see isn't working that well at other IRBs. So even that's been kind of fun, although that might be, something I didn't ever anticipate that I would be doing. In undergraduate, I was really interested in psychology, and I hadn't taken any pre-med courses. I didn't really know that much about what psychiatry was, to be quite honest. I didn't grow up in a family of physicians, but my father had a cousin who was at McLean at Harvard, and I spent a summer with him and his family, and I got to volunteer at McLean Hospital and Phil Holtzman's lab. And it was really exciting for me. I've also volunteered in some of the patient units, and I got very interested in this. But it was just at the end of my undergrad, and I hadn't done any pre-meds, so I had to figure out what to do now, because I thought psychiatry was really cool, and I wasn't prepared for that. So I went to University of Pittsburgh, and I was a research fellow with David Kupfer and Ellen Frank for 3 years. And while I was there, I took all my pre-med courses while I was doing research with them. And that was really great, because I kind of got this, I got to dip my toes into psychiatry as a research assistant there, and I published a bunch of papers with them. And so I knew by the time I hit medical school that I wanted to go into psychiatry, which was kind of unusual. A lot of times people are still, sampling. And so even during medical school, I could keep up some of my research activities. And by the time I finished medical school, I knew I was headed for psychiatry. And I also knew I was interested in research. So when I finished my undergrad, I went to a research track at Yale and sort of kept embedding research in my training all the way through. When it comes to, leadership, I thought someday I wanted to chair a department. I told my husband early on, I thought someday I'd like to chair a department. But, as you progress through your career and you figure out what your strengths are and your weaknesses are and what you kind of love and gravitate toward, I kind of came to a point where I decided that my strengths and my assets weren't well suited for that, and that there were other areas of leadership where I might shine more and be more successful and be happier. Coming into leadership was maybe something that's been a characteristic of me since I was a child, but coming into leadership in a field where most of the leaders are men has been a little bit challenging along the way. I was very lucky early on in my career, like psychiatry residency and early in my life after residency as a junior faculty, that I had some really strong relationships with psychiatrists who were leaders in the field who were very generous in networking me, including me in their symposia. For many years, I was like the token woman on the panel giving the talk when Charlie Nemiroff and these other guys were giving talks. And so I guess in a way I was lucky, but those networking opportunities were important for me. And I felt also like I developed relationships with multiple mentors. I had a very solid scientific and career development mentor, Larry Price at Brown. But then I also had these really strong mentoring relationships with others in the field, and increasingly peer mentors and female peer mentors. And I think all of that was important for me. I would tell anybody that is thinking about making their way through an academic career to have multiple different mentors and get perspectives of different people, because each one can bring something different to the table to help you navigate your way through this or that hurdle. There might be other barriers for me in my career that are just the kinds of things everybody faces. Increasing burdens of administration when you're a researcher. I think my tip is to find a person on your team that's really good at some of that stuff and to keep them no matter what it takes, right? If you can have a right-hand person that can ease the burden of administrative activities as a researcher, get that assistance level that you can really, somebody who knows you and gets you and you trust them and they trust you, to offload as much as possible is critical. And that might be harder for women than it might be for others. An organization like SOBP is ideal for junior investigators to get involved and to move into committees where they're making friends and colleagues, not just networking, but kind of grabbing those opportunities, get to know people a little bit more than just, my co-committee member. And I think there's opportunities in an organization like this to become a committee chair and to have leadership in committees and then move on to other committees and to find your way onto council and have a significant leadership role in this organization. One thing that's been sustaining for me is that I have really close friends in these organizations. When you spend a lot of hours working, right? You have less downtime for socializing in your daily life. Every time I come to a meeting, it's a huge reunion for me. And I love getting together with my friends who are colleagues. For many years, I'd have Christmas cards from people all over the country that were my academic colleagues that I'd see twice a year at a meeting. But it's great to have really close relationships and have made friends. And I call upon those friendships when I need advice or collaborators or, your opinion about something. But really more than just colleagues, I feel like I've made great connections with the community here. And it's very inclusive. There's nobody that's really left out from attending a meeting or joining a committee. It's an organization that embraces people who want to do that, to make colleagues, have community, have friends, and have some longevity with the organization to the point that they can move into leadership positions. And you don't have to make your way through a big hierarchy to have a leadership position in SOBP. It's really willingness and energy. I guess for women, there's a risk, though, because women can get caught up in a lot of committee leadership roles. Women tend to do it very well. They tend to be very organized and affiliative. And, you have to be careful to delegate appropriately, too, so you're not using all your time to run the whole show. I was particularly excited when Mary set up this women's leadership group. At first, I loved that it was sort of this small, closed group because it was just really, a great group of girlfriends in a way. It was this nice, very intimate thing and it's like, I think, it's like the kind of club that men have had for many years, right? I was really excited also to see it grow and branch into a bigger committee and initiative that will help nurture women coming into the field so that they can develop the confidence and have the support to become leaders. Having a couple women friends who are successful as good, close colleagues is essential. It's so important to be able to pick up the phone or text a friend or email somebody and say, I'm navigating this. And I think it's also essential to hear how it goes in other institutions. I've been at Butler Hospital and Brown University for 20-some years, and often I need to hear from other people about what it's like in their setting to either appreciate how good I have it or to understand a different angle that I might ask about when I'm trying to navigate or negotiate something, and even thinking about how to grow. When I hear about other institutions and how other positions are set up, I find that very valuable, and I think that's something that I recommend for people, is to have some close people that you can compare notes with. Yeah.